name?
Hi, my name is Mayra G. I'll be your nurse. We're gonna be doing a head-to-toe assessment on your body. I'm gonna do some hand hygiene and provide privacy. What is your name?
Anna
And your last name?
Macias.
And date of birth?
8/1/1988.
Okay, perfect. Appearance and posture is correct. Hygiene is good. Behavior and consciousness is normal in effect. So I'm going to be asking you some orientation questions.
Mm-hmm.
Do you know who the president is right now? Trump. Okay. Do you know where you are right now?
Yukon Medical Center.
Okay. Do you know what we're doing?
An examination.
Okay. Do you know what year it is?
2006.
Okay. What about what did you have for breakfast?
Some eggs and coffee.
Do you happen to know who the first president was?
George Washington.
Okay. Her level of consciousness is correct. Alert and oriented times 4. So now I am gonna inspect her hair, and her head is cephalic and symmetrical and normal. I don't see any lesions, no parasites or no dryness. I'm also gonna do a neck inspection. She has no jugular vein distension. Can you move your back to back? Now do it brown. Any pain, tenderness?
No.
Okay. So I'm gonna check your lymph nodes. Any tenderness when I touch?
No.
No? Okay. So I'm gonna check your carotid artery. Symmetrical, no problems. And lymph nodes are normal. No bruit noises. And now I'm gonna check her eyes. I'm gonna use my pen light. And I want you to follow it. Okay. Can you follow the pen? Okay, perfect. Pupils are normal. Iris brown in color and equal and round. I'm gonna check your conjunctiva. I don't know how to pronounce that word right. So I'm gonna take off your glasses and I'm gonna pull down on your eyes. They're clear and normal. So I'm gonna have a little test, and I want you to read the letters, the smallest letters that you can see.
E, F, C, G, M, L.
Okay, now cover one eye and read them again.
L, F, C, L, G, E.
Okay, now cover the other one. Do the same thing.
L, M, T, L, B, C.
Okay, it's 2020, no problems. Now I'm gonna do a confrontation test that has been already done. And the corneal light reflex has already been done also. Now I'm gonna check your perla, so I want you to follow don't move your head, just follow my finger. Perla's normal. And when was your last eye exam?
Like a year ago.
A year ago? Do you have an appointment coming up to do
Yeah.
another one?
Mhm.
Okay, good. So now we're done with your eyes, and we're gonna go ahead and check for your ears. When I touch like that, is there any pain, any tenderness? Any pain, any tenderness?
No.
Okay. So I'm gonna do a little test. I want you to keep looking straight and see if you hear what I say when you cover your ear.
1, 2, 3.
Perfect. Now I'm gonna go on this side, and I want you to cover this ear.
1, 2, 3.
Okay. Perfect. There's no lesions or any problems with her ears, and that hearing is correct. Now I'm going to check your maxillary sinuses. Is there any tenderness when I touch?
No.
Okay, perfect. I want you to open your mouth and say ah. Okay. Mucous membranes are normal. I don't see any caries. Teeth are color normal, no problems. Okay, I want you to open and close. Open and close. Any problems biting, swallowing?
Mm-mm.
Can you swallow for me? Okay, perfect. It looks normal. Trach, it's midline and normal, symmetrical. Tongue is normal, uvula is positioned correctly. And when was your last dental exam?
Like a month, 6 months ago.
6 months ago?
Mhm.
Okay. Did they tell you you had any problems? Was
No.
it normal?
Everything's normal.
Okay, perfect. Now we're gonna go ahead and continue with that respiratory assessment. And I'm gonna be listening to your lungs and in the front and the back. Her respirations are 18 per minute, which is normal. Her lungs are symmetrical, and she's moving pretty normal. Listen. Now I'm gonna listen to your lungs in the back. I'm gonna start over here to your right. Perfect. Her lungs are clear and normal. No problems with her breathing. No shortness of breath. And her chest expansion is symmetrical and even. Now, everything was good, so we're gonna do your cardiovascular assessment, and we're gonna palpate and listen to your heart. I'm gonna start with your radial pulse. Okay. The radial pulse is normal, 72 beats per minute. The rhythm is normal and regular, and I'm gonna auscultate your heart. I'm gonna start with the aortic, pulmonic, mitral, and your apical pulse, which is in the fifth intercostal. Has regular rhythm and symmetrical. There was no extra sounds and no sounds of any murmurs. Now I'm gonna listen to your vowel sounds. Thank you. They're normal, they're non-hypo or hyperactive. Can you tell me when was your last bowel movement? Last time you had number 2?
Oh, an hour ago.
Did it look normal? How was it?
It was normal.
It was normal. Any constipation,
No.
diarrhea?
No.
No problems with that. Okay, perfect. Have you been having any nausea, any intolerance with foods?
No.
Any weight changes?
No.
What's your weight and height?
150 and 5'4".
Okay, perfect. You can sit now. What about when you void? How many times do you pee a day?
Like 4 times a day.
4 times a day?
Mhm.
Do you drink a lot of water?
Yeah.
Okay. When you go to pee, does it burn or hurt?
No.
Any problems with that?
No.
Okay, perfect. Any smells, any weird smells when you pee?
No.
Have you had any history of blood in your bowel movements?
No.
Perfect. Okay. And now we are done with the abdomen assessment. Now I'm gonna ask you some private, personal about your reproductive health. Do you do breast monthly exams?
Yes.
Okay. When you do them, have you noticed any asymmetrical areas or masses in your breast?
None.
No? Okay. Any tenderness, pain?
No.
Extra dimples?
No.
Okay. Any nipple discharge?
No.
Okay, perfect. When was your first period?
When I was 15.
15? And do you still have periods monthly?
Yes.
When was your last one?
Like a week ago.
Like a week ago. Any problems with it and any extra bleeding, like excessive pain,
No.
cramps? No? Okay, perfect. Are you sexually active?
Yes, I'm married.
Okay, do you use any birth control?
Some pills.
Okay, perfect. Do you have any questions?
No.
Okay, perfect. We're done with that. Now we're gonna do the neurological exam. I'm just gonna be asking you some questions and gonna be moving some areas in your body. I'm gonna be using my little hammer. I'm just gonna be hitting right here. Any problems? Tenderness?
No.
Okay, perfect. Now I'm gonna use something else. I'm gonna use a dual area and a sharp area. And I want you to close your eyes and tell me if I'm using my sharp or my dual area.
Sharp.
Okay. Dual or sharp?
Do.
Okay. What about over here?
Do. Sharp.
Perfect. Now we're gonna do some coordination, little exam. I want you to do some rapid hand movements. Go like that as fast as you can. Any problems with it?
No.
Okay, I want you to grab my hands and, okay, good grip. Perfect. We're gonna do the Rosenberg test, which is a balance test. I want you to get up and just stay straight and close your eyes. Open your eyes. Close your eyes. Any dizziness? No? Okay. You can have a seat. Now we're also gonna do a tenderman walking, which you just put one foot next to the other and go like that. Okay, it is normal and I don't see any problems. Now we're gonna continue with the musculoskeletal test. We're gonna do adduction and abduction. Okay, perfect. Now with your elbows, we're gonna do flexion and extension. Flexion and extension. With your fingers, we're gonna do adduction and abduction. Abduction and adduction, flexion and extension. Flexion and extension. Okay, perfect. Now with your hips, I want you to go like this and go in and out. Now do the other one, in and out. Any tenderness, any pain?
No.
Okay. Now with your ankle, we're gonna go up and down, flexion and extension, and dorsiflexion. And now we're gonna do the other one, plantar and dorsiflexion. Perfect. Now we're gonna do the flexion and extension, flexion and extension. Perfect. Any problems with that?
No.
Okay, I want you to have a seat. And our last thing that we're gonna do, I have already checked your head and there was no lesions, lesions or any problems with that. I'm gonna check your skin. She has normal color for ethnicity, no tinting, no dehydration noted. Capillary refill is less than 2 seconds. Perfect. Sugar is normal. She has no edema. Temperature is normal. And moisture to her skin is dry and normal and warm. And so we are done with your assessment now. Thank you for coming.
Thank you.
Thank you.